Episode 26 of the Athletes First Performance Podcast. Today, we're talking about the barriers and facilitators to human performance programs within the military. This podcast is based on a paper from Dan Rohn and colleagues titled Perceived Barriers and Facilitators to Implementation of Injury Prevention Programs in the Military, Feedback from Inside the Trenches. The data collected in this paper is from a cross-sectional survey that was circulated to key stakeholders within military human performance programs. These stakeholders include military leaders that are in unit and brigade command, as well as branch specialty leaders. They also surveyed medical professionals, including athletic trainers, physical therapists, occupational therapists, sports medicine physicians, and orthopedic surgeons. Last was performance professionals, including strength conditioning coaches, and personal trainers. The purpose of this paper was to assess injury prevention program stakeholders, perceived barriers and facilitators to implementation of injury prevention programs, and general perceptions of important implementation variables related to injury prevention programs in the military. So today we're just going to take a wide view of the four key themes stated in this paper. And in following podcasts, we'll take a deeper dive into each one of these themes in order to draw out lessons learned and best practices from the key leaders that were surveyed in this paper. So what were the main barriers to injury prevention implementation? A common theme throughout the paper was resources. So barriers include insufficient resources, which is equipment, facilities, funding, and lack of manpower. In regards to manpower, is having adequate number of people on a performance team, as well as having quality program staff. After resources was addressing the unit culture. Significant barriers were units not prioritizing health and fitness, insufficient leadership support and buy-in, and poor prioritization of these programs. Last was insufficient knowledge about how and what to implement, as there was no standard measure of processes or outcomes from which to learn, adapt, and show value of the program. Key quotes collected from the survey were leaders thinking that they know more than subject matter experts and disregarding the subject matter expert inputs. Commanders don't buy into injury prevention and also don't require the soldiers to participate. Having the old school mentality is that we only need to do push-ups, sit-ups, and run to be fit. And even a successful program has a hard time having dedicated leaders show up or prioritize the program. As we move on to the facilitators, you'll notice that they're very similar to the barriers. One of the key facilitators to a good program is having sufficient resources. So having good equipment, facilities, and funding, and then having an adequate number of competent and trained personnel. And they made sure to say that there's more than just the physical personnel included in these programs. So not just having strength coaches, physical therapists, and athletic trainers, but making sure that we address the cognitive, spiritual, and nutrition aspect to improve human performance and injury prevention. Next was having good leadership support. So being able to prioritize the program and making sure that there's dedicated time and availability of the service members to be able to work with the subject matter experts. And making sure that programming is integrated into the long-range training calendar and battle rhythm to make sure that there's adequate amount of time for the human performance program to be integrated within the brigade. And last was having standardized and pertinent metrics for unit value and culture. So being able to collect useful data and be able to present it in a meaningful way to make sure that the human performance program is making significant changes and moving the brigade or the unit in a positive manner. Key quotes that were collected from the data in regards to facilitating the human performance program were making sure that training programs were written by strength coaches, physical therapists, or athletic trainers. Leadership being able to understand that they are not trained in this area, but know how to utilize the assets to reach the overall injury reduction goal. Acknowledging that soldiers are not athletes and addressing basic foundational fitness needs from the lowest common denominator to the high performance. The next key theme was leadership support. So what are some key examples of leadership support? So leaders can better support programs by mandating or incentivizing participation. So some key quotes here were issuing strict guidance that starts the process of culture change and making it easier for soldiers to attend services provided by H2F. The leaders also need to be able to value the information that is provided by the subject matter experts within the team. So leaders educating themselves about the importance of injury prevention and human performance and being receptive to the evidence-based principles provided by the human performance experts. Next, which I think is most important, is the leaders leading by example. So if the senior leaders in the unit utilize human performance, the soldiers will follow as well. Other quotes for leader support were require and check the metrics of utilization and make it a competition between different units, implement utilization policies for the programs, and allow and facilitate subject matter experts, such as strength coaches, physical therapists, to develop, implement, and monitor physical training and injury prevention for all units. The last key theme for implementation is perceived methods to improve subject matter expert SME collaboration. So this is all about creating buy-in. Key points under this category include the program staff should model the change they expect from others. So a quote here is being an example of the values that they want the units and soldiers to have and be seen practicing what they preach. The need for subject matter experts to integrate into unit culture and doctrine. So that means being included in battle rhythms, unit operations, and the long-range training calendar, and helping the soldiers understand how and why physical training plans are developed. The SMEs also need to be able to collaborate the shared goal of getting command support for program implementation. So what does this look like? A key quote here is, the only thing I've seen work is a high-ranking individual in a command role has to work with the subject matter experts and present them to the unit squadron for the information to be heard. Leader buy-in is all critical and must start with the leader's priorities, and then the subject matter experts can support these efforts. So like we said at the beginning, this is just a brief overview of the 4 key factors to implementing human performance programs within the military. Over the next several weeks, we'll dive deeper into these categories to provide real-world examples and lessons learned to better implement human performance programs within the military.